Hello, my name is Robert Hayden, and today I would like to share with you a protocol for treating perimenopausal brain fog. Brain fog is the popular term for what is known in biomedicine as mild cognitive impairment, or MCI. There is no strict definition. There are no biomarkers. It can't be determined by a lab test. It will not show up on imaging. If you look at a brain MRI of someone who has brain fog, you won't see the fog on the MRI. It'll look totally normal. The symptoms associated with brain fog are difficulties with cognition, including memory impairments, issues with focus and attention, mental cloudiness, slowed processing time, forgetfulness, etc. Biomedicine has no real effective intervention. And brain fog is a feature of many different types of conditions. Very commonly nowadays, you'll see it in post-COVID syndromes, also chronic fatigue or myalgic encephalomyelitis, fibromyalgia, hypothyroidism, and of course, in the perimenopause. There is very little mention of brain fog in recent TCM research. When one does find reference to perimenopausal brain fog in the modern TCM literature, one tends to see a few patterns, most common of which is depletion in the sea of marrow. The sea of marrow is, of course, the brain, and the brain marrow is dependent upon the kidney essence for nourishment. So there is an underlying kidney essence insufficiency, which may manifest with features of yin vacuity or yang vacuity and is treated accordingly. The second pattern is liver blood vacuity with depression of liver qi, and this is tied to the cessation of the menstrual cycle. The menstrual cycle is associated with what is called the tiangui, which is the sort of ability to bear children, and liver blood and liver qi have this mutual yin yang relationship in which when blood is unable to nourish the liver, then we have difficulty in the liver's function of moving the qi or coursing and discharging. This also manifests as wood unable to nourish fire, thus the fire organ or the heart is also depleted of blood, and this leads to problems of the liver soul or hun and the heart spirit or shen. Then there is the pattern of phlegm turbidity clouding the brain orifices. This is a buildup of phlegm and turbidity in the upper burner, which blocks the brain orifices. And at the heart of this is the spleen's inability to transform fluids or to raise clear yang to the head. And so turbid phlegm forms and blocks the brain orifices. So those are the basic TCM pathologies according to the modern literature. Now you can apply these patterns in clinic, and this is pretty much the cornerstone of modern TCM, right? You determine the pattern and you use the points and the formulas that are associated with it to treat. But acupuncture and moxibustion is based on the channel system. And I went looking for ideas about how to construct a channel-based approach to treating perimenopausal brain fog. When we look at the symptoms of perimenopausal brain fog and compare them to the old disease classifications in classical Chinese medicine, one of the closest matches that we find is what is called forgetfulness or absent-mindedness, Zhanwang. And when I went looking in a book called Differentiation and Classification of Patterns and Treatments, or Leizheng Zicai by Lin Pei Qin, this was written in 1839, just before modern TCM, right? The century before modern TCM. In the section on forgetfulness, Lin has this passage, which I found very interesting. It says, forgetfulness, Zhanwang, is suddenly forgetting something and trying hard to think about it, but it doesn't come. A person's Shen spirit resides in the heart, and the essence of the heart relies on the kidney. Furthermore, the brain is the palace of the original spirit, Yuan Shen, the sea of marrow, and is in fact the place on which memory depends. Thus, Lin says, in treating forgetfulness, one must connect the heart and kidneys to cause the Shenming, the illuminated spirit of the heart, to flow freely downward to the kidneys, so the kidneys' florid essence will ascend upward to the brain. And how does the florid essence of the kidney ascend to the brain? Via the dumai. The dumai, or governing vessel, is the pathway for the essence to nourish the brain marrow. And here is a passage to that effect from Yelin, from his work Explanation of Latent Qi. So the brain marrow is nourished by the kidney via the dumai. The dumai, or governing vessel, transports essence to enrich the brain and governs the yang qi of the body. All of the yang channels converge there to reach the brain. In Classic of Difficulties, or Nanjing 29, it talks about how the dumai enters the brain in a shu, or dependent, or belonging relationship, similar to the luo relationship that you see between organs, right? Between zangfu, like the kidney and the bladder, or the spleen and the stomach. So the extraordinary vessel dumai has this relationship with the extraordinary fu of the brain. Now, besides the extraordinary vessels that enter the brain, there are some of the regular channels that also enter the brain, the most important of which is foot taiyang, or the urinary bladder channel. The foot taiyang enters the brain from the top of the head, or du 20, as well as from the jade pillow, or UB9 point. The foot taiyang connects with the heart and the kidney, and is an important linkage of those organs with the brain. So, looking through the Great Compendium of Acupuncture and Moxibustion from 1601, you can find some indications for points on these channels which match those of perimenopausal brain fog. The first and most important is Du 20, 100 meetings, Bai Hui, which is indicated for forgetfulness, losing track of things, mental confusion, lethargy. Manual of Acupuncture says that when you see indications of a disharmony of both heart and brain, this is a good point to use. Also, Du 11, Spirit Path, or Shendao. This is indicated for abstraction, sorrow and anxiety, forgetfulness. And this is located beneath the spinous process of the fifth thoracic vertebra, and this is the same level as the heart shu point, making it the heart point on the dumai. And on the same level, over on foot taiyang, is the heart transport point, the back shu point for the heart, bladder 15. And this has indications like chaotic heart chi, or mental abstraction, manic running around, weeping while speaking, and forgetfulness. So, from this idea that in order to treat forgetfulness, one needs to link the heart with the kidney and the brain, I constructed this point prescription. First, in order to open the governing vessel, use the master and coupled points, Jiaohui points, for the Dumai and Yang Chalmai, which is small intestine 3 and bladder 62. Then on the Dumai, treat the heart and kidney points, the heart point being Du 11, which we just discussed, and then for the kidney point, Du 4, which is the Mingmen point. It governs the Mingmen fire, which is the fire that steams the essence so that it can ascend and nourish the brain. Next, on the foot taiyang channel, we use the back shu points for the heart and for the kidney. The back shu point for the heart is bladder 15, as just discussed, and bladder 23 is the back shu point for the kidney. And this should help the kidney essence to flourish and nourish the brain via the dumai. Finally, we open the heart and kidney connection to the brain with Du 20. And Du 20 has this lifting and ascending action, which helps to bring the essence upwards to the brain. And that's the prescription. If you want to treat the patterns that we talked about in the beginning of this presentation, this particular prescription is especially suited to the depletion in the sea of marrow. However, if there is liver blood vacuity, you can still use this. Simply add the back shu point for the liver, which is bladder 18. Or if there is spleen vacuity with turbid phlegm, then you can add the back shu point for the spleen, which is bladder 20. You can use needles, you can use moxibustion, you can use acupressure, toina, shiatsu, you can use a teishin. Any way that you like to work with the channel qi, you can use on this method. And I've already begun applying this to patients who have brain fog, including perimenopausal brain fog. And I think the results are encouraging. Now I'm sharing it with you in hopes that you and your patients can also benefit. My name is Robert Hayden. Thank you very much for listening, and take care.